Professor Chen Hailin, the first person to treat cancer with traditional Chinese medicine. Cancer is the main hidden danger that endangers human life. Although human research has more than 100 years of research history, countless scientists and medical scientists in the world have been fighting against it. They have been on a solid road, and there are almost no achievements. Understand cancer, conquer cancer, and destroy the mantra that humans cannot overcome cancer. Professor Chen Hailin has been the cause of cancer for decades. His personality is perseverance. As long as he recognizes things, no matter how difficult it is, he cannot shake his determination to complete his hard work. Based on this spirit, he wrote The Pursuit of the Motherland and Apo's drugs and eliminated people and Apo's disease with more than 40 years. This is a patient with very advanced lung cancer, Ms. Chen Hailin, a 53-year-old Chinese citizen from Shaanxi Province. On September 3, 2012, I went to Professor Chen Hailin's treatment. The image shows that the right lung completely disappears, the left lung is incomplete, and the space-occupying myocardium ischemia and arrhythmia. Stuffy, shortness of breath, back tired, sore, numb, travel pain, complexion gray, lips purple, body cold enough. Crop. After 6 months of treatment with traditional Chinese medicine for extremely advanced lung cancer, he bid farewell to taking medicine for life without recurrence or conversion. The immigrant survived for 6 years and 8 months and finally walked more than 10 miles of mountain roads in the cold winter, dragging each other. I returned home with a healthy body, but there was no heating equipment in the house. The family was poor because of the death of her sickly life in the cold room due to exhaustion. According to the escort of the outer courtyard, introduced by the member, the result that should not have happened is really unpredictable. Kui Dongfu, male, 59 years old, lived in Shala Village, Diansheng Town, Luqing District, Chengzhi City, Shaanxi Province. I started taking traditional Chinese medicine from May 30, 2016 to February 20, 2017, taking a total of 23 doses of Chinese medicine. The patient was supposed to be in a very serious condition, coupled with long-term radiotherapy and chemotherapy. His body was weak, his platelets decreased, his immunity was low, so he did not pay attention to it. Leaving spring 2019. Gastric cancer patient Guo Wensheng, male, 58 years old, Chinese nationality from Chengzhi City, Shaanxi Province. The patient underwent gastric cancer surgery in Chengzhi Peace Hospital on March 23, 2013 due to gastric cancer. Half a year after the operation, he developed stomach pain, hyperacidity, loss of appetite, acid reflux in the morning and evening before and after meals, fatigue, insomnia, weight loss and other symptoms. I do not want to go to the hospital for fear of checking for cancer. On September 17, 2013, I came to see a doctor for treatment. Emaciation, sleepiness and pain in the stomach area, aggravated after meals, acid regurgitation and vomiting, fatigue, red tongue, greasy yellow coating, thready and stringy pulse. After several months of treatment with traditional Chinese medicine, the symptoms have obviously improved and no recurrence has been seen in the past 9 years so far, and everything is good in follow-up. In the Spring Festival of 2023, return visits to patients are in good health. Stomach cancer patient, Chen Hailin, male, 55 years old, Chinese nationality from Shanxi. The patient came to Professor Chen Hailin for treatment on March 28, 1995. Main complaint: on August 21, 1994, gastric antrum surgery was performed in Heping Hospital affiliated to Chengde Medical College. After the operation, he had liquid food for half a year. As a result, the patient lost only 85 kgs. In mid-January 1995, I went to the hospital again for an examination. The anastomosis was narrow and needed to be expanded. A stent was placed. Due to the financial difficulties of the family, there was nothing he could do. Introduced by a friend, I learned that Professor Chen specializes in treating cancer, so I made a special trip to see Professor Chen for treatment. First visit: the patient is emaciated, has difficulty swallowing, mainly liquid food, local pain, dry mouth and tongue, dry stool, red tongue with yellow greasy coating, slow and stringy pulse. Syndrome differentiation, deficiency of yin and hyperactivity of fire, local stenosis, deficiency of qi and hemagglutination. Treatment: replenishing qi and nourishing blood, replenishing body fluid. From mid-March 1995 to July 1995, a total of 4 months of TCM clinical treatment. The patient began to take general food as the main food, and after examination at the nearest hospital, it returned to normal. In less than half a year, the patient had a large appetite, and because of the busy teaching, he had no time to take the medicine, so he ignored the traditional medicine treatment. In the years to come, I can see much. The weight changed from 85 kgs to 148 kgs. In 2011, a bad news came suddenly. When the patient was building a house by himself, he pulled the steel wire with a tractor. The steel wire accidentally hit Teacher Shen's nose, and the blood flowed. Because there was no one to take care of him, Teacher Shen fell down in a pool of blood. He passed away. In the past 7 years, Mr. Shen has not had recurrence and metastasis, and it will happen if there is no change. It should not be. Bone cancer patient, Li Lianjie, female, 73 years old, family member of the Staff Hospital of Handan Iron and Steel Group, Company, Limited, Hebei Province. Due to the large number of medical records, here are a few cases, for your reference only: multiple bone malignant lesions, bone cancer. Example: 73 years old, a family member of a staff member of Hangang Hospital in Hebei Province, origin, Chengde, Shanxi. First visit, March 1, 1998. Chief complaint: the patient went to Handan Iron and Steel Hospital on February 27, 1998 to do ECT whole body bone imaging, and the inspection number 0143 showed findings, and quote, the third and fourth tracer distribution of the lumbar spine, abnormal concentration and quote. Diagnosed as multiple bone malignant lesions and quote, the patient requested traditional Chinese medicine treatment. On March 1, Professor Chen Hailin went to Handan Iron and Steel Company, Limited to see a doctor for the patient. Syndrome, emaciation, pale complexion, moaning in bed, inability to take care of urination and defecation, abdominal pain, irregular seizures, anorexia, chest tightness, cough, insomnia, sublingual varicose veins, pale tongue with thin white fur, weak and stringy pulse thin. Dialectical, yin deficiency of the liver and kidney, body fluid is consumed secretly, an accumulation of poison obstructs collaterals. Treatment, replenishing qi and nourishing yin, nourishing kidney marrow, softening and detoxification, chemotherapy and dredging collaterals. After more than 40 days of intensive treatment, the above symptoms of the patient were basically eliminated, and the patient was able to get out of bed and walk, take care of his bladder and bowels, and move freely. On April 20, 1998, I went to Handan Iron and Steel Hospital again for ECT whole body bone imaging, examination number 143. Compared with the bone imaging on February 27, the abnormal radioactive concentration area of the lumbar spine basically disappeared. The third and fourth bone activity of the lumbar spine is basically normal. On May 1, 1998, when Professor Chen Hailin visited the patient for the third time in Handan Iron and Steel Company, Limited, before leaving, the patient, accompanied by her husband and 5 relatives, went to the station to see Professor Chen Hailin off, expressing the most sincere thanks to Professor Chen Hailin. Stomach cancer patient, Li Yingzi, female, 63 years old, Chinese nationality from Shaanxi Province. On April 2, 2010, came to see a doctor for treatment. The main complaint was that the patient underwent gastric cancer resection in a hospital in Chengji in March 2009. After radiotherapy and chemotherapy, half a year later, he developed stomach pain, radiation vomiting, and a mass on abdominal percussion, which was diagnosed as peritoneal metastasis after gastric cancer surgery by a hospital in Chengji. The hospital doctor requested hospitalization. The patient and APO's family members and a to take traditional Chinese medicine. First visit, the patient was thin, pale, dizzy, vomiting and diarrhea, abdominal pain and distension, pale red tongue with sticky and whitish coating, weak and stringy pulse. Dialectical, stagnation of qi and blood coagulation, obstruction of collaterals by phlegm and dampness, accumulation of stases and toxin. Treatment, dissipating stagnation and removing blood stases, raising yang and stomach, tonifying the kidney and detoxifying, nourishing qi and blood. From April 2, 2010 to the end of September 22, 2010, I feel good about myself. She had a follow-up visit on July 16, 2016, and she was in good health. Engaged in agricultural labor. On March 24, 2023, patient Li Yingzi and APO's husband with her husband. At present, Li Yingzi is in good health and is engaged in housework. 12 years are coming. I wish her good luck, happiness and health. Looking back on the past few decades, Professor Chen Hailin has experienced too much in the difficult years. One-sentence summary: 99 points of sweat, 1 point of inspiration, more than 40 years to achieve leapfrogging. Professor Chen Hailin expanded the space for thinking and imagination from multiple levels, systems, directions, dimensions, and channels. Combine traditional culture and quote, Book of Changes and quote, and quote, 5 elements and quote, with Qigong, yin and yang, and self-cultivation. Under the guidance of the theory of multidimensional addition of triple burner gasification in traditional Chinese medicine, it is organically combined with modern medical diagnostic methods and imaging data. Prepare symptomatic drugs, perform gasification, intervene in the gasification center, spleen and stomach in the human body, perform upper and lower gasification mechanism, enter the lesion, quickly curb the proliferation and metastasis of cancer cells, directly kill mutant cancer cells and repair missing mutant cells and cytoplasm, reversing cancer cells into normal physiological cells. Theoretical basis and quote, Qian Yuan Gda Lun and quote, says, and quote, heaven is gas, earth is shape and gas are interconnected and transformed into all things. And quote, therefore, the understanding of human physiology and pathophysiology in and quote, internal classics and quote, is completely from the perspective of and quote, transformation of gas and quote, come to understand, from the perspective of and quote, gasification and quote, to study physiological phenomena, pathological phenomena, disease diagnosis, treatment. The preventive principle of the human body, through the evolution of gasification, can quickly achieve the goal of eradicating tumors. Using all specimens, a comprehensive cancer treatment plan with unique characteristics and innovative thinking of traditional Chinese medicine has been created.